Does that resonate for you, this idea that there's a health equity gap that is cheekily here, but it's zip code related, but that there are geographic and socioeconomic determinants in healthcare?
So absolutely. When I first started med school, I did MD, PhD at Duke, and the original intention was to do my PhD in immunology. I'm not sure I ever told you this story. I told you and Maria about this, but I was going to do immunology and study HIV. But then during my second year of medical school, during my clinical rotations, I pivoted from immunology to medical sociology for my PhD for this very reason, David, because I saw that there were these things that had a very real, significant, and often negative impact on the health of my patients. But it was, quite frankly, in many cases beyond the reach of medicine. And I wanted to understand what were those factors. And one of those main factors, right, those things that fall under that umbrella of what we call social determinants of health or social drivers of health. One of the main factors is exactly what you're talking about, which is the idea of where you live, and how your zip code, your environment, your neighborhood impacts your access to any number of resources that correlate with health outcomes. And it's interesting in this country because if you look back, we see a lot of, they talk about segregation, right? Which is like where people are, where populations are. In this country, it's not something that happened by chance, or quite frankly, in most cases, by choice. Much of the segregation in the United States was dictated as a result of prior policies, things like redlining and so forth and so on, that drove what we see. But unfortunately, in those same segregated neighborhoods, we saw that there were less resources invested into certain neighborhoods, which created a vicious cycle that has driven, again, the creation of these environments that are unhealthy for people to live in, that drives the disparities that you're speaking to around health equity.
I want to build on something you said, Maria. You used a really lovely phrase about meeting people where they are. And, Dr. Wilder, I'd love to turn to you with that one a little bit, because I think, again, there are probably some folks who come into your clinic who have understanding and access to all the best medicine and all the best care. And they've got a mobile phone where they did their research before they saw you with Dr. Google, one of your colleagues. And they've got a laptop at home where they can do what we're doing, and they can Zoom back and forth with you in telehealth. And there's probably other people that come to your clinic or that you have to go out to in a mobile clinic that don't have access to all those things that we just assumptively assume people have access to. How does that change the practice of medicine, and how do you deal with that meeting people where they are piece?
Yeah, that's a really, really important point that you all are making. As we think about the environments that people work in and their access to resources in those environments, what it means to live in those environments, that impacts our ability to engage them in healthcare, right? So, there are individuals in my clinic that are right here in Durham. And then there are individuals who are more sort of in more like a less urban, more of a rural space. There are individuals in my clinic that I see that come from different states. And all those patients, and then within those sort of spaces, right, there are people in various sort of levels of engagement with things like telehealth, telemedicine technology, people with various levels of resources in terms of transportation and ability to get to clinic, and of course, significant variation or heterogeneity with respect to one's individual's ability to engage in healthcare, i.e. health literacy. And so as providers, we have to be mindful of the individual and what obviously what is their health issue. But as we think through how to address their health issue, what is the best way to navigate this with this particular person? And as you alluded to with zip code, that zip code often dictates the people, their resources, the things they have access to. And so as we think about healthcare and how we deliver it, we need to be very mindful about the sort of resources in those environments based on like one zip code, and then think about the best way to engage those people.
I love the example you gave about the role of churches and synagogues and those sorts of things in communities, yes. Because I think, as healthcare marketers and communicators, we've always thought that the most important imprimatur we could put on anything was a person like yourself, highly trained, in a white coat. There's the physician. And I think what I'm hearing you say is that there are folks for whom the most important opinion leader may not have MD after his or her name, but may have pastor after his or her name, right? That's the point you're making.
Absolutely. And in fact, there's actually research that speaks to the value of, particularly in the kinds of communities we're talking about here, the value of the church, the synagogue, the barber shop, these spaces where people have entities that they trust, they have conversations, open, free conversation. And you're right. I think thinking about how we can better leverage those types of environments within communities will be important as we think about how to provide better health literacy across the board.